Hi, this is Sally Morgan, physical therapist, craniosacral therapist, and Tellington Teach Arch practitioner for animals and people. This is Tristan. He's a Corgi, and he's wearing his necktie for this episode of Conversations with a Corgi. So today I want to do a quick look at something that I hope never has to happen to you. However, if you hike a lot with your dog or if you are a driver, you may find yourself in a circumstance when a dog that you know is in shock. And first, let's talk about what shock is. Shock is not like, oh my God, something happened. Shock is a physical situation in the body. It's not an emotional situation. We always say, oh, I was so shocked when she said that. But no, shock is actually a situation in the body where there is a loss of circulation. And that means the blood pressure will drop and the brain and the other organs will not be getting enough blood. And that is a serious, life-threatening, often deadly situation for a person or a dog. So it's really important that you have some ideas about what to do when this happens. Dogs can go into shock from obviously trauma, being hit by a car. It can be something that they walk away and you think they're okay. There could be internal injuries, which could result in shock. It could be a severe allergic reaction, which in the summertime is a big deal. We have so many things flying around that could possibly bite our dogs, and you have to keep, obviously we look for swelling and things, but sometimes a dog can go into anaphylactic shock. And that can also cause other shock, meaning that lack of circulation in the body and damage to the nervous system. Shock can also be caused from excessive vomiting and diarrhea. A lot of times in the summer, my mom's dog used to eat random dead things in the backyard of their old house, and she would end up with vomiting and diarrhea, and that fluid loss can also cause shock. And it can be caused by choking and obstructions in the breathing apparatus by something like pneumonia. This is a life-threatening emergency if your dog is in shock and you need to call the vet and you need to get your dog to the vet. Some of the early symptoms that you'll look for are bright red gums and a really rapid pulse. There are several places to find the pulse on your dog, and maybe we should do a whole episode on this, but some of the places are up here on the neck. There's Tristan's. You can also find it down here in the armpit. You can also find the heartbeat. So make sure that you're getting the pulse and not just the heartbeat. You can also, the easiest place that they teach you to find the pulse in a dog is up here under the back leg on the femoral artery. It's right up in here. And you can put 2 fingers on the inside of the thigh and feel that pulse. Your dog may be acting uneasy or anxious or nervous, and they may have very shallow breathing when they're in shock. And at this point, you still can find the pulse. You should practice finding the pulse on your dog. You should do it every day for a week so that you get really good at it, because when your dog is in serious shock, you will find it harder and harder to find the pulse. So you need to know where it is and how to find it in a flash so that when it's not there, you know your dog is in a medical emergency and that you're just not inept at finding it. When shock is getting worse, the dog's gums will turn pale, as will all of the fluids and the tissues around their eyes. If I open Tristan's eye, sorry, bunny, here I can see that it's red around his eye or up on his gums. Open the jabbers, let's see. He says, Mom, we're on camera, it's so embarrassing. But if I look in here and see pale gums and pale eyelids and lips, that's a sign that the dog is going into a deeper shock. You will not be able to find the pulse very easily. Your dog will be weak and lethargic and stumbling or not even getting up. Breathing may be shallow or rapid or normal. And suddenly the skin, mouth, and legs may be very cold because the blood will be pulled from the extremities to try to get to the heart. So, and if you take a temperature, you may find that the temperature from the rectum is lower, but it also may be higher, and it also may be normal. So temperature is not a reliable thing. When shock is getting really severe, your dog will be unconscious. The gums will look white or spotty. Your dog's heart muscles will start to fail. You will not be able to find a pulse, and if you do, it will be very weak. The eyes will become glazed over with a stare, which sometimes people can confuse shock with a seizure if you're not familiar with either of these things. The T-touches that I'll show you work for both of those situations, but in either case, call the vet and get your dog to an emergency vet immediately. The respiration in severe shock will be shallow or rapid and deep, and your dog may be unable to move due to lethargy. He may be in a coma, and there could be a stupor in his gait and his demeanor. So this is a really serious emergency. There are several things that you should do, which is keep your dog warm because the extremities will lose their circulation. So if you have one of those space blankets, you should, and we might actually do a few series on these, assemble a doggy first aid kit to have in your house, including a space blanket. And often a good human first aid kit with a few additions can be a good doggy first aid kit. So make sure you've got one of those space blankets because you're really going to need it if your dog is in shock. Don't let your dog move around too much. Try to keep him quiet. You can put him in a crate or even just lock him in a very small room. Anytime that there's a fracture, obviously you want to protect that. If there's a wound, you want to treat that. You want to clean it out and put sterile dressing on it, and again, transport your dog to the vet ASAP. If there is blood coming out of your dog, like seriously, you want to stop the bleeding by applying pressure, the same as you would for a human. You can massage your dog's paws gently to try to increase circulation there, but don't be scrubbing them and rubbing them like you do warming up a child who's been outside playing in the snow too long. You want to make sure that your dog's airway isn't blocked, and that's another whole thing that we need to look at. But basically, if your dog is unconscious, you can open the mouth and make sure that the tongue is clear so that your dog can breathe. And try to stay calm yourself. That is so important because dogs respond to the hysteria of people. And I have been around several dogs in life-threatening emergencies, and the owner is very, very stressed out. And as a professional, I have had to stay very calm and help the person stay calm and formulate an action plan quickly in my head and deal with it, because sometimes that's what it takes. And your dog can be so stressed out when you're stressed. We all know that. And any of us who have ever seen a dog in any kind of a car accident have felt that horror of that situation. So make sure that you keep yourself calm by breathing, and that will help your dog as much as anything. If your dog is unconscious, we have that old thing, face is pale, raise the tail. So if your dog is unconscious, put a blanket or a small pillow or your coat or your shirt under his buns to try to keep the blood running towards the heart and their head. You want to improve the blood flow to the brain as much as you can and get your dog to the vet. So as you might recall, we've talked about this many times, and this can save a dog's life, a horse's life, a cat's life, and even in many cases, human lives have been saved by these T-touches. So there is a shock point in acupuncture at the tip of your dog's ear. This point, if rubbed gently and consistently, can help keep your dog present and can help improve that blood circulation throughout the body, and it's made a real difference. I have used this many times, more than I can count, and I can tell you it makes a huge difference, particularly with someone in shock. And anytime I've helped a person with a bike accident, actually, that was seemingly minor, but they were elderly and frail, and she was passing out. Hadn't hit her head, but the shock of the bike accident and kind of rolling down a hill a little bit for the senior citizen was too much. So rubbing her ears made a huge difference in her ability to even tell us her name. So this point I'm rubbing on Tristan right now is the shock point. And you're going to rub it, if your dog's ear flops down, you're going to rub it towards the direction the dog's ear goes. But just gently between your thumb and your first finger. And remember, if you're stressed out, you may be pushing on this ear too hard. So you want to practice this too, so that you're nice and gentle when you do it. Dogs that are in shock but not unconscious yet can be reactive in their behavior. So even if it's your own dog, be super careful when you do this, and be really aware of helping them stay calm. The other points that you want to remember are those 3 points, the triple heater meridian, right where the head joins the ear. One is for respiration, one is for digestion, and one is for reproduction. And just doing your T-touch circles, again, practice these. Right now I'm doing some lying leopard here, but you could do clouded leopard, you could do raccoon, anything that you can remember on these points, even just rubbing them if you're really desperate, can make a big difference in helping your dog when he's in shock. It would be best if you can get someone else to drive you to the vet so that you can stay in the car with your dog rubbing his ear point here, the shock point. And I have gotten many a dog to a vet with the person driving the car while I'm in the back seat doing this and ready to jump into CPR if I have to. So make sure you practice these things to help a dog if you ever come across one that's in shock. And it can happen even from like a snake bite, a spider bite, any kind of reaction like that. And as I said, nausea, extreme vomiting, diarrhea, fluid loss in the summer. Severe dehydration can result in shock. So practice finding that pulse on your dog's femoral artery up under his hind leg, and practice the T-touches on his ear, and especially here for respiration. Right, Tristan? He says, oh yeah, practice that one more. So that's a quick review of what to do if your dog is in shock. Or someone else's dog, and these same things apply to cats, horses, and humans. So please remember to check this stuff out, and I think as we go along here, I'll give you some ideas about some things to put in a dog first aid kit. I have helped so many other bloggers and web managers figure out what to put in their dog's first aid kit that I think I'll make a little suggestion up for you. And I think I have one, maybe even still intact, that my sister used to make and sell for people to have for their horses, that contained a few emergency items that we would be happy to have around, including that space blanket. I have one somewhere in this house. It used to be in the car, but I think I should indeed get it out and put it in a first aid kit. Although, frankly, having a space blanket in the car can be a really good thing. Those are those like aluminum looking blankets, because if your car ever breaks down, or if you ever do come across an accident, and I've come across several accidents with horse trailers where I've had to use my space blanket on a horse to keep him out of shock. So, and, you know, it's good to have a first aid kit in your car and in your house. So thanks for joining us today. That's a quick review of what to do if you find a dog in shock, and to help manage a situation for your dog or another dog. And as I said, this applies to all animals. Thanks for joining us today. I think my boy needs another bath. He had his collar on for his last bath, and he's a bit stinky where the collar was, where I didn't get enough cleaning from the beach. You need a rough cleaning today, Biss. You need your rough scrubbed. Look at all the dog hair on the table. Thanks for joining us today. We'll be at our jobs as educators tomorrow, and we will be back again on Thursday for another episode of Conversations with a Corgi. Thanks for joining us, everyone. Thank you, Danny. Thank you, Deb. And we will see you guys soon. Everybody have a great day.